Assalamu alaikum. Mayam ngasi Eikhoigi University ki yamna maru oiba campus sama tuberculosis aidana TB laina sigi special oina hangba ama lei madugi campus tu da Eikoi chaturi aduga maduda presentation TB gi presentation gi numitai madugi presentation tawbodo Eikoi masi ningsing nabagi damakta kona gi khalaga video si semjabani adra mayam yangminasi kamai tawbage haibatu blogger amoina yamna changnai ka video semjadana tawbana chade akoi loidore maduna mbbs ki aroiba chahi oibaga loinana aroiba exam su akoi kuidre aduna sum khalura kanda akoi loidore kana khallaga nungairakta maduna sum khara akoina tawba mafam sida leiri kan gi tabak thorom khara do sum namnaga thagachabani yangminas
respectively. Transmission usually occurs when infectious people cough, sneeze, talk, or speak and gather from tuberculosis bacilla. During primary infection, organisms may spread systematically and at the later stage may be activated at the genital site. Genital tuberculosis may be sexually transmitted. In fallopian tubes, it's 90 to 100%, endometrium 50 to 60%, ovaries 20 to 30%, cervix 5 to 15%, vulva and vagina, it is 1%. And in tuberculosis of the fallopian tubes, we can see that both tubes are involved in 100% of cases. Muscle layer, and after that fibrosis, segmental thickening, tobacco pouch appearance, which will be shown in the picture later on, and physiopinks, sulfingitis, smicanodosa. And in the outwards, it spreads in sulfingitis with exudation.
So it is very deteriorating condition and it is very infectious. And I would like to talk about right now the basics of tuberculosis. Everyone I explained earlier, like how it spread, what is symptoms, and what are and the most important right now is COVID-19 is going on. So how it is COVID-19 and this merge with tuberculosis, it's also very difficult. So the first I will like to transmission. Transmission is from man to man, from person to person, and the causative agent is Mycobacterium tuberculosis.
Mycobacterial therapy remains the cornerstone of treatment, but the response is slower than with pulmonary tuberculosis. Persistent pain and swelling are common, and paradoxical upgrading reaction may occur in 20% of the patients. Treatment of tuberculosis of the lymph nodes lasts up to 2 years and is carried out in a specialized tuberculosis dispensary.
Остановка Велта. Следующая остановка – почта.